Maddie, thanks. You know, more people than ever in Hampton Roads are now eligible to get their COVID-19 booster shot, but a lot of folks still have plenty of questions.
Yeah, investigative reporter Margaret Kavanaugh joins us live in the studio. So, Margaret, what can you tell us?
Well, right now, certain people can get a booster shot at pharmacies and clinics around the region after the CDC expanded eligibility. And we met up with one Norfolk man who was one of the first in line.
I feel like if you have the opportunity to do it, you should just go ahead and do it.
Eric Haas felt side effects from his COVID-19 booster shot.
Could not move, muscle aches. It was similar to my second COVID shot.
But he says he's glad he did it.
So for me, as a 60-year-old man, it's worth it because I have some pre-existing conditions. I want to make sure I get every shot available to humankind.
And he's following the advice from the CDC. 6 months after getting the Pfizer or Moderna vaccine, you're eligible for a booster if you live in a long-term care facility, work, or live in a high-risk setting, have underlying medical conditions, or if you're 65 or older. For the 15 million people that got the Johnson & Johnson shot, boosters are recommended for anyone 18 or older as long as it's been 2 months since they got their vaccine. Why do we even need a booster?
As our immune system weakens over time, we don't have as many antibodies. So you're more likely that you could get an infection from COVID. You're less likely to die from it if you've gotten the first 2 doses and less likely to be hospitalized from it. But you could still get it and pass it along to other people.
Sometimes it's not just about your health, it's about other people's health and not spreading the virus to other people.
The CDC has now said that you can mix the booster shots. So if you had a reaction with the first one, you could try a different one.
We are recommending that in some of the research is if you had a bad experience with one of them, you may try a different one and it may not give you the same side effects. So that may be a wise idea.
For Eric, he's glad to have another layer of protection.
That's one of the great things about living in the 21st century. We have solutions to these problems. It's not like 1918 when there was no solution.
The big question, will this be the last booster? Now, experts say at this point they just don't know. Some medical experts think that people will need to get a COVID vaccine just like you get the flu shot, but they say there's more data that needs to be researched and looked at before any kind of decision like that's made. We have more information on our website if you're interested in getting a booster, WTKR.com. Margaret Kavanaugh, News 3.